Hello everyone, I'm Dr. Prerna Tayal, consultant obstetrics and gynecology at Indrashila Hospital, Gurgaon. Today I'm going to talk on a very different topic. Many patients who are suffering with infertility must have heard ERA, those who are opting for IVF or those who have faced recurrent IVF failures, they must have heard about ERA. And ERA is nothing but it is a diagnostic tool which is used to identify the genetic expression of the endometrial lining, about whether how optimal is it to accept the embryo which is being transferred inside the uterine cavity. What it tells us is that whether the endometrial lining is receptive on the day we are transferring, or it is pre-receptive or it is post-receptive to the day on which we are transferring the embryo. What we do is that in this we give a mock cycle similar to the one which is given while preparing for transferring the embryo, and we take a biopsy of the endometrium and send it for analysis of the various genes which are responsible for handling all the implantation purpose. And once the report comes to us, it tells us whether the endometrium lining is receptive. That is, the endometrium that is the day on which we have taken the biopsy of the endometrium. It is the day which is best suited for the embryo transfer, or is it pre-receptive? That is, the lining needs some more time or more time for exposure of the progesterone to become receptive for the embryo transfer, or is it post-receptive? That is, the lining has missed its peak for the embryo to transfer. That means the embryo should have been transferred before the day which we are planning to transfer it. So ERA is one of the tests which has helped in increasing the success rates, especially in people who are facing recurrent IVF failures. So do get the test done in order to find out the best time for the embryo transfer and to increase the success rates. Thank you, and do follow for more information.